Okay, we have a quorum, so the meeting is called to order, and I'm required to start with the script yet again. So, excuse me. As a preliminary matter, I'm Mary Ann Easley, Chair. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. So when I call your name, please say here. Allison.
Here.
Diane.
Here.
Vanessa? Not here. Kendra? Not here. Jude? Not here. Susie?
Here.
Nancy?
Here.
Linda? Not here. Mary Ann here. Staff, when I call your name, please respond in the affirmative. Jericho?
Present.
Yeah. Hold on 1 second.
Laura?
Here.
Great. Good afternoon. This open meeting of the Council on Aging is being conducted remotely pursuant to Chapter 20 of the Acts of 2021. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. For this meeting, the Council on Aging is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything that you broadcast may be captured by the meeting. All supporting materials that have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless noted otherwise. Then they go into some ground rules, but just a reminder, I'll just say this off the cuff. Just please be aware that when you're speaking, that you're not muted, and that when you're done, well, please try not to talk over other people just because it's so difficult with the Zoom app. So I guess with that, we can go ahead. So the first item is the approval of the agenda. So can I get someone to make a motion to approve the agenda?
I move we accept the agenda.
Okay, that's Allison. Is there a second?
Second.
Nancy?
Second.
Second. And now I
Second.
have 2 seconds. I have to do everything going down the list of attendees. So if you approve the agenda, please just say yes or aye. Allison?
Yes.
Diane?
Yes.
Susie?
Yes.
Nancy?
Yes.
Mary Ann, yes. Thank you. Next is the approval of the minutes from our last meeting, which was October 6th, and everyone should have received those from Laura and had a chance to look them over. So thank you very much, Diane, for that.
Yes, thank you.
Mhm.
Yeah. Can I get somebody to make a motion to approve those minutes?
A motion to approve.
Susie? And is
Susie.
there a second?
Second.
Is that Nancy?
Yes.
Okay. Nancy was a second. Again, I have to go down the list. So if you approve these minutes, well, first I should say, does anybody have any comments or edits for Diane on the minutes? So no need for discussion. Okay, if you approve, please say aye. Allison?
Aye.
Diane?
Aye.
Susie?
Aye.
Nancy?
Aye.
Mary Ann? Aye. Okay. That takes care of all of the administrative stuff at the beginning. Thank you, everybody. Now moving on to the first item on the agenda, which is the grant, the Title III-B grant, which we received, federal grant. And I have now attended the orientation session, which was held via Zoom for all the grant recipients this year, of which there were 13. 13 organizations on the Cape and Islands got grants awarded. And if anybody is interested in seeing a list of those, let me know and I'll ask Laura to send them out. I think also Allison, you probably have that whole list, but if anyone's just interested, it's a list with just 1 or 2 sentences describing what each of the organizations received the money for. So essentially, the orientation was mostly about the monthly reports that we have to submit about what we've achieved and how much it costs. That's basically it. So what I'd like to do at this meeting is get everybody's ideas out. I know everybody has great ideas for how we should recruit people who are carpenters or whatever we need to do all these home modifications, and how we can get clients who have those needs and then mesh these two together. So what I'm hoping today is to kind of have an open discussion, people throwing out a lot of ideas. And as a result, what I'm going to try to do is put them all into some kind of a draft plan that I would bring back to next month's meeting and have everybody do your edits, that sort of thing, so that we can all get on the same page and launch this program. I hope in a small way first, and then it will probably grow. So I know everybody has ideas. I know, you know people who need things, and people here know carpenters and plumbers and, other tradespeople who could be helpful. So I just want to open this up to anybody's ideas, and I'm going to do my best to jot them down. And I know, Diane, you'll get it all too. So let me just open this forum for anybody to say any ideas that you have about how we could best meet the needs of seniors who need home modifications in order to be safe.
I got a question.
Yeah.
Can we use the grant money to pay for advertising? Because I think getting something in the paper or are there restrictions on what we can use the money for?
I don't know exactly. I don't know.
There are restrictions on what we can use the money for, and I don't believe in the grant application we included any request for advertising costs. So there's a potential we would not be able to use grant money directly, but we can probably scare up some advertising costs out of the human services budget if that proves absolutely necessary.
Okay.
And I wouldn't hesitate to go to the NCEA and ask them for money, because I think we certainly have their support for this program, especially because I guess a number of years ago, something similar was tried and the money had to be returned because it was never used. So I don't want us to get into that position again. So I'm sure that we'd have their backing. Anybody have anything on your mind having to do with this? Positive, negative, helpful? Nancy?
Possibly Laura could insert something in her newsletters on a weekly basis, or even the monthly Salt Marsh Gazette, asking participants or anybody who would be interested in receiving services. That would be a good way, I think, to target a lot of the seniors. So that's one. The other end to that would be the Nantucket Builders Association generally has meetings once a month, and this incorporates everybody. It's not just the carpenters, but it's all the builders from all over the island, whether you're a plumber or electrician, possibly making an appeal to them. If they would not give up their services, maybe they would do it on a reduced basis. Be
Okay.
something to look into.
As a matter of fact, people would be we do expect to pay people. It's just that it's based on whatever the rate is that's established by the Commonwealth. So, and I don't know what that rate is. I'm going to need Jericho's help to find out from Human Resources what that is. But once we start trying to recruit professionals, we're going to have to tell them what we're willing to pay them, of course. So they will get some payment.
Okay.
So the specifics on that is the town has a prevailing wage guideline, and I've been waiting for finance to get it back to me. I am now prompted by this meeting, going to poke them again and be like, hey, where's that sheet? That'll give a range in which the town will pay And I think it's not really negotiable. That's basically what it is, but it's based on the prevailing wage for similar work.
Do people have to present RFPs?
No, I believe there's no need for an RFP. As I understand it right now, we need to have the potential contractor be a vendor for the town, which means filling out a W-9 form if they haven't already. And then submitting, they don't have to submit bids or anything, the amount is too small. So basically, COA will decide which contractor they can use. As long as they're paying the prevailing wage, it's up to them to pick anyone that they want to. So I think you have some leeway there. There is a potential that we need to, like, we're not accepting bids on this, so we don't have to collect a variety of bids. We don't need a request for proposals. You guys determine a town compliant contractor that you want to work with. You get a W-9 sorted out with him and through HR, and then they are paid as the work gets done, and we can keep billing against this particular grant until it expires.
Yeah, and I should add that each of these people who's providing services has to have a query check through the police department. That's one requirement. And also they have to have liability insurance on their own. So we will not be providing that, and they must show proof of insurance.
Is there a list of people who are already signed up to be town vendors?
Oh.
Yes, but getting that information from finance has been challenging.
I was actually hoping that Jude would be here since her husband is a general contractor. He might be able to send us in a direction as well as the building association is certainly a place to start. But Jude having a husband who's in the business, he also could give us some direction, I think.
I think it would be a good idea to get an idea on what the Commonwealth would pay before we start asking around.
Yeah, the Commonwealth, it's not the Commonwealth, it's actually the state, the town of Nantucket that has these prevailing wage
Okay.
guides, and basically that'll determine what we pay them.
I think the other thing we're going to have to think about is the expectations of both the providers and the receivers, because if I had somebody who's a professional coming into my home to put in a grab bar, I might show him other places that need repairs. And we want to make sure that everybody understands this is only limited to those modifications that are for safety purposes and not for a dripping faucet or anything else that you might have waited around for somebody to come and repair. So we're going to have some sort of a handout to give to both the providers and to the clients, and just to make sure that everybody understands the guidelines. And those of you who are in the real estate business, you're probably used to dealing with people's expectations and having any number of them be over the top.
You're talking to me?
Yeah, you and Susie. Setting expectations seems to be something we're going to have to do.
I mean, I think we can start with, aren't we sort of continuing on a program that the fire station already does, but doesn't have resources for?
The fire station limits what they do to changing the batteries in your smoke alarm. And then they take along somebody who just looks around to see, do you need something under your rugs to make them slip proof? That's very, very simple things, but anything that requires a hammer and nails, they don't do.
Yeah, and this is actually a very different program in that fun way of government, where this is a Generation Safe is a fire safety program administered through the public safety organizations. This is a human services, what's it called? A human services project for senior quality of life improvements. It doesn't seem like a big difference, but it actually is. Different revenue streams, different bodies administering it, different standards of like demonstrating your work as you go along.
And Vanessa has also sent me a form that they use out at Sherburne Commons when people have need. And that's something we can incorporate into this as well, where people describe what their specific need is, so that we can match them with the appropriate person to solve the situation.
So it sounds like we need an application.
Yeah, and that's exactly what they use out at Sherburne Commons. It's just a simple form though, 1 page.
Let's just copy that.
Yeah, definitely. Definitely. Any other thoughts that anybody has? Has anybody heard of anybody doing this anyplace else that we could copy that?
Not really.
If I make a suggestion on how you would handle this, it would be as follows. I would be in touch with Elder Services, be in touch with Generation Safe. You can talk to Barbara Vandergroben. She was the clinical side of Generation Safe. And you can get a list of people from them, and then you can, because online signups are going to be difficult for this age demographic, maybe print out a sheet, and then you distribute that to the list of people that you've developed, and then that is then filled out by the people and then returned by mail or whatever.
Sounds good.
Yep.
Okay. Unless anybody wants to add anything, I think what I'm going to do is come back to our next meeting and with an actual written proposal for everybody to critique or approve so that we can get going. In the meantime, we do have to start filling out these monthly reports. So the first report is going to be in the planning stage. And that apparently is okay. That's one thing that was part of the orientation.
So I want to get a little bit off the track. What do we do about people that just won't allow anybody in their house or that have issues? But does anybody keep track on any of those people on Nantucket?
Most likely
Or
Elder
elderly.
Services, I think, is the one
They do.
that keeps track of, has the closest thing to a list of, like an authoritative list of elderly people. And then Generation Safe also has people that they've previously contacted. I think that advertising both in the Salt Marsh newsletter as well as in the IM is probably a good idea on that front. Or potentially getting in touch with a couple of writers on the INM, specifically the people who are doing current, like, Jason Grazier Day, the INM, and maybe it might be more advantageous to have a story done on this than just to do advertising.
Right.
Oh, say that again. It would be best to have a story.
So you can get advertisements for them, but I think the other thing is we're in relatively slow news time. So if you reach out to the INM and be like, hey, well, this is a thing that we're doing. We'd like you to do a story about it to raise like awareness of it. That's another really good outreach approach.
Okay.
Your demographic here is probably overrepresenting INM readers. So that's a really good, like, hitting that a couple of ways is good. Whereas social media, that kind of stuff is not going to reach the people who need to hear about this program.
Well, don't you think also once we have one client, we might even send something to the current to do a story on that one client who just got whatever he or she needed.
Oh yeah, I mean, I'm not sure exactly the best way to sell them on the story, but I'm pretty sure you could get a journalist to look at this program even before you have anybody, or you can find somebody and have them be sort of the model case and then have a brief story written about them. It's actually, I hadn't thought about getting somebody and then having the story. I would think about it like in the lead up, just so that we have enough people aware of it, but either way works.
Right. It also occurred to me that there are plenty of people who don't feel safe having some stranger come into their house. And one of the good things about Generation Safe is that at least the first time that a fireman came to my house, it actually was a firewoman, but she came with Barbara Vandergroben, who represented the Red Cross at the time. And it just felt good to have two people there as opposed to one stranger. So we might want to even consider having somebody accompany, a worker person in there, but that's another detail to be ironed out down the road.
It's a good way to spread the word to tell a story, and then other people might jump on and say, oh, that sounds pretty safe to me. Maybe I could
Yeah,
ask or see. I don't know.
yeah.
I have one question. First of all, I liked what you said, Jericho, about calling it senior quality of life improvement. I like that. And Mary Ann, what were you coming back with next meeting?
Could you repeat that?
What were you coming back with for next meeting?
I'll come back with a draft plan of our approach
Yeah, okay, thank
so
you.
that everybody can have their chance to amend that in any way anybody sees necessary. And then we can actually all get on the same page and proceed with this. We're probably going to
Okay.
stumble a little along the way, but that's to be expected with something new.
I agree, and thank you for drafting it, Mary Ann, and
Not a problem.
Right,
stepping
Okay.
up to go to the orientation meeting.
Yeah, the orientation meeting was very useful this, Allison, because you go to their
Yeah. No,
Elder
that-
Services of Cape Cod and the Islands meetings, but just to see other people from other towns, and there were many different kinds of programs that were funded, and it was good to get a broad cross section of the Cape and Islands. So yeah, that was good. First time I did that. So you're right.
Yeah, no, it's good.
Educational.
Can we move on so I can do my stuff? Because I'm gonna have to jump off. I might be able to jump back in. I don't know how long this is gonna go.
Do you want to go now?
Yes, that'd be, I mean, are we finished here?
Yes. So we can jump to number 5, dementia friendly Nantucket, and then go on with Elder Services.
There's no super new news in the dementia friendly front. I did, Susan Hostetler, of all people, is interested in working on this. Of course, she just left to go to wherever she goes in the winter. So, but I've been contacted. I mean, I've been in touch with her and talked about the dementia friendly program. And as somebody who's a downtown merchant or shop owner, she'd be a good connection, because that's one component of it, is getting the downtown organized and together. So no big news on that. And then the meeting on the 27th of October with Elder Services of Cape Cod and the Islands was again interesting. It's there's a lot of, they're working on the spending plan for the American Rescue Plan. So there's going to be a lot of money from the state rolling in to Elder Services. There's already money that needs to be allocated, and there's more that's going to be coming in. So I think, they're big, the big thing is collaboration, technology, protective services, respite for caregivers. Those are the top 3, or the ones that they mentioned that I thought could be most useful here. But what else? Has anyone done, they do free radon testing. I know we don't have a big radon problem here, but that would be something we could offer seniors, perhaps in the newsletter, is radon testing. They had a 100 volunteer luncheon off island. One of the councils on aging had a luncheon for 100 people. So I hope we can get our seniors of the year luncheon scheduled. They had it at Cranes Beach, but it was inside. And so that was interesting. They are starting congregate lunches. Yarmouth started, Marston's Mills started, Barnstable and Brewster are going to be starting soon. And one town in the Vineyard is offering congregate lunch. They're coming along rather slowly. There are only 10 diners in Yarmouth and 5 in Marston's Mills. But how are we looking for a congregate lunch coming up here, Jericho?
I was actually that's going to be based on ESCC's guidance. I think they're the ones currently like determining whether we do it or not. So when Elder Services gives us the go ahead, basically, like, I think
Oh, I
Laura
thought
and I,
it was you.
no, it's not me. I like I control the business, but we don't fund that, and we don't determine the guidelines for when it's okay. That those are all. Laura, you can follow up on this a little bit, right?
Sherry Hunt is the person, and she will let me know when she gets the go-ahead from the big guys. So it's just a wait and see.
Laura, who are the big guys if some Cape?
I think they're in Dennis, if I'm
No,
correct.
that's
Right?
Elder Services. I mean, that's.
Yeah, that's where they
that's
are.
I attend.
So yeah, to the
It's
best of
all
my
done through her.
to the best of my understanding, congregate lunch is determined. Like the people who say yes or no on congregate lunch is not me, and it's Sherry Hunt.
Exactly.
Well, I'll email them and just see.
I mean, I'm keeping the mask mandate for I think another week at this point, and then if cases are low, I'll remove the mask mandate. So there's two thresholds to cross: me removing the mask mandate from the salt marsh, and then Sherry Hunt determining that congregate lunch is good to go.
So is
And
it looking like those things are going to, we're going to be back to normal very soon, maybe in November? Hard to tell.
I think there's going to be a pretty marked jump in cases over the next 2 weeks. So the determination of what normal is has to be made, and that's above my pay grade. As far as the operations of the salt marsh, I will be the last place that takes masks off on the island, basically. So, you know, if Sherry says the go ahead on congregate lunch and our case numbers are low, then I will be happy to reinstate that program. But the highest risk group on the island doing the highest risk activity together and indoors is not something I really want to be jumping on as soon as possible. I want to kind of like slow rolling that.
All right, and then there are still 479 people waiting for services through Elder Services because of the lack of providers. So we have one provider that works here. I didn't ask, and I don't know how they break it down as far as what communities have how many numbers, but I'm sure Sherry would know. But there still are a lot of people waiting for services through Elder Services, which always really surprises me. But that's a lot for the housekeeping end of things. But that's just about it from that meeting.
I have a question for you, Allison, about the radon testing.
Mhm.
When is that money likely to be available?
I believe it is available, and I'll look into that too, to see if there's some little ad written up that we can put in our flyer.
Yeah.
I don't believe we have radon on Nantucket.
Yeah, I mean, I don't
We
either.
don't.
Probably why.
So it
I think
doesn't,
I've heard of one radon case in my whole life, so maybe,
I'm pretty sure we're pretty 99%.
yeah,
There's no bedrock.
yeah, I will.
You'd have to have bedrock to create that. I mean, there are places that live outside of Boston that have a lot of heavy stone under their houses, and then they all most of those have radon, but we're safe here.
okay, good.
All right, guys, I got to jump off. I'm sorry. Anything we need to vote on before I go?
Not that I can think of. But thank you for that report.
Yeah, I'm sorry to bug out. I didn't set this meeting up and it's the initial one, so I don't want to miss it, but
Happy 4th of July.
yeah, happy 4th of July. There's something happening.
Yay.
All right, I'll try to come back on if this is brief.
Okay, thanks,
Bye.
Allison. We're going to go back to number 2 on the agenda, which is the status of our celebrating seniors of the year. So I'm going to look to you, Laura, or where do we stand on this?
We stand that the seniors of the year are going to be around in January. Representative Fernandez is going to be here Friday, December 3rd, but that's way too soon, and it's also stroll weekend. So I replied to see if he was going to be here anytime in January. I spoke with Bill Pooter at Fairgrounds. January was open to him. If everything goes well with the town and the BioBot, et cetera, you know, the last Thursday in January might be an option. We can cancel at any time if COVID rears its ugly head again. He said it doesn't, there will be no cost and no time thing. You know, we would obviously give him enough time. He orders his stuff, you know, once a week, so it's not, you know, that big of a thing for him. So that's where we stand. I guess we're just waiting to see what happens over the holidays. And, you know, late January, early February, you know, just to be able to get all the invitations out, not really out, but get them back. That's more of where the waiting is. So that's where we stand, and we'll formalize that. And maybe Representative Fernandez is not here, but maybe his gal who's on island can do it. And usually we try to get Libby at least, and maybe some select board members. But we have to get all the certificates. We need a date. I need to get COA, Mary Ann to sign it, Joey Gear to sign it, Libby to sign them. So it does take a little bit, you know, so hopefully we can do it end of January, beginning of February.
Sounds good. Anybody have any questions for Laura? Actually, I have one. You know those seniors of the year of 2019 that just slipped through the cracks? I sort of feel like we're ignoring them totally now that, you know, life might return to normal. And I'm wondering if we can somehow celebrate them along with our current ones. But I'm just throwing this out to everybody to see how people feel about that. But I just feel like Jeanette and Peter just fell through the cracks and never got celebrated. Any other thoughts on that?
Good idea.
I don't want to sound weird, but I sort of feel like that time has passed and we're already sort of moving forward, and they did get celebrated in some ways. I mean, I read some things on them, and, you know, it just happens to be one of those years where we've had COVID issues. In other words, I don't feel like they're going to feel less because they did get the award.
Okay.
Do they?
That's just, I mean, I don't know what anyone else thinks, but
I've never been to one of the luncheons. Do they come to the luncheon as outgoing seniors,
Yes.
or they're
You
not
mean
the outgoing
Past
seniors?
seniors
there?
of the year.
Yes,
Diane,
were they?
you past seniors of the year.
Yes.
Yes, they are all invited to every single luncheon, the past seniors of the year. So they will be invited to this luncheon. And so something could be said. They've already
Yes.
received everything, but a mention could be made by,
I
COA.
personally would like that.
because they
That's my
will be
2
there.
cents.
Well, they're invited to be there.
Okay. I
So
like what you said.
I have one other question, and that is, how did we get that number of 400 and some odd people that are looking for services? Where does that number come from?
That was Allison, who has now left the meeting, but she attends the broader meeting of Elder Services of Cape Cod and the Islands. And I'm pretty sure she was talking about all of the Cape and Islands towns. That's the total number. And I don't.
Not just Nantucket,
Not just
okay.
And I don't believe we have, I think she even said something about not having a specific number from Sherry Hunt, who runs the services here. So I guess we'll just leave, I was bringing this up, but we'll leave the celebration of the current seniors of the year just to them, and the fact that the other recipients from the previous year are going to be invited. We can acknowledge them simply from the dais, whoever is our master of ceremonies. And I'm going to assume that's okay with everybody here without even taking a vote. I see heads nodding. Okay. Okay, we'll leave it at that. Any other comments on this topic? Thank you, Laura. Thanks for staying on top of this.
Sure.
A lot of moving parts. Jericho is next to talk about human services and what's going on.
Yeah, so we're in grant season right now. I'm going to lead this off with the non-COVID related stuff for my own sanity. We're in grant season right now, so a variety of different organizations, among them Elder Services and a couple of others, are coming to the town for grants. What am I saying here? Sorry, just had an update regarding the prevailing wages sheet that I was going to get to you, Mary Ann. So I'll follow that up, but I lost track of what I was saying. Oh, right. So it's grant season right now. We're getting a lot of different human services grants for everything from Artists Association to Elder Services to Fairwinds. Applications to those are all in. We will also be accepting applications for the cannabis grant money that's allocated to behavioral health, specifically addiction services. Then the network of care should be in a position where I'm going to start releasing it. I'm going to introduce it to you guys probably at the next meeting if I get all the back end and aesthetic stuff done. Network of care is basically a directory of all services available through the town of Nantucket for everything from elder services, behavioral health, et cetera, et cetera. So we should be advertising that and introducing it directly to the senior population through NCEA, Saltmarsh, and this organization as well. And then in COVID news, currently there's no mask mandate. The mask advisory remains in effect, so everyone should be wearing masks indoors. And then we're tracking through the wastewater where we are in terms of samples collected from other towns. So basically we have a measure of where we are relative to other towns when we pass the median amount. That is when there are 50% of the places sampled have lower numbers than we do. That is, as soon as we pass the median and become part of the half of the country with higher higher viral concentrations than others, the mask mandate will go back into effect, and we'll communicate that. Then we are currently the town, and this is the part where it gets complicated, so bear with me. The town, which has been doing booster shots in the trailer for 3-4 months, or 3-4 weeks at this point, possibly more than that, I forget. We, as of today, are no longer doing booster shots. So the town is out of doing the booster shots from now on. You have 2 sources of booster shots on the island right now. That's Nantucket Cottage Hospital and their Monday clinics. The call center doesn't seem to know that they're doing these clinics, but they are. And the Dan's Pharmacy specifically doing Moderna. With the approval of Pfizer over Moderna and Moderna over Pfizer, you can now get a booster shot from either of those 2 locations, regardless of what vaccine you got initially. Bear with me for just a moment. I'm going to close my door. Apologies for the background noise. So as of today, the town will be out of doing booster shots. We will still be running the 1st and 2nd dose clinics. If you know of anyone who does not have a 1st or 2nd dose, send them to the trailer on Sundays, please. We're only going to be doing 1st and 2nd doses for another, I think, 5 weeks or 6 weeks. And after that, I cannot guarantee anyone on Nantucket a 1st or 2nd dose. So please spread that along. If you know people who are hesitant or waiting or whatever, send them my way on Sundays. Past that, there will be pediatric vaccinations. The hospital is announcing their plan for that, hopefully in days or weeks. And then there will be, that's basically it for regularly scheduled vaccines right now. The hospital will be doing booster shots for 65 and older, as well as, 1 second, then I'll get you.
Okay.
We'll be doing 65 or better, as well as occupational categories, as well as the immunocompromised. There will be a clinic running for pediatrics, and then health imperatives and Dan's Pharmacy will be offering individual first and second doses, but I do not know for how long, and I do not know the procedures that they're going by. Sorry, Diane, what were you going to say?
Okay, so just to make sure I'm getting this correctly,
Mhm.
so the town is no longer doing the booster shots, but Nantucket Cottage Hospital is on
Mhm.
Mondays, you said?
And they have an online sign up that you can use to self-select an appointment over Mondays. I
Online
believe they're
sign
booked
up.
out until the 17th.
And also Dan's Pharmacy, also by appointment,
Yep, and that Dan's Pharmacy is Moderna only.
is Moderna only?
Mhm.
Okay, and then there was noise and I couldn't hear. The pediatric shots probably will be announced in a few days.
Yes, that's basically it.
Okay,
Does
Case-
Dan's Pharmacy charge anyone a fee for the, I believe they do, but maybe it's not for some, but
So I know that Dan's Pharmacy can bill insurances, and that they can apparently, I'm finding out, bill at different rates depending upon what kind of insurance you have. But there should be 0 point of sale or point of contact charge to the person getting a vaccine. There is, as far as I know, 0 cost to an individual. They can be billed through insurance, but that is picked up by the insurance as an administrative cost, because every dose of vaccine distributed in the US was bought by the federal government and then distributed throughout. So they're getting free doses, basically.
okay. One more question, and that's for over 65 or compromised.
So it's over 65, anyone can get one. People who are under 65 years of age, but have a set selection of immunocompromising diseases can also get in, as well as people in certain range of jobs. I think that retail, childcare, a lot of the early access categories from the first wave are reapplied in there. The criteria for accepting those are on the sign-up sheets. So they'll ask you to self-certify that you are either a member of this category, that category, or you work in this job.
Okay, thank you.
No problem. It's chaotic, so it's not easy to follow, and I do it all day, and I still am surprised constantly.
Jeremy, can I ask you a quick question?
Of course.
I had an appointment scheduled and I didn't realize it was with the fire station. It was through the town of Nantucket. Called the hospital to find out and they said, no, come on in. Got there and they had no record. Now, these people that did get the Pfizer through the town initially, are you transferring those records over to, you're not?
So what we do is when we verify, or when we administer a vaccine, we upload the information for a person into the state database, the authoritative database maintained by the state of Massachusetts called MIIS. MIIS is the legal holder of the information of your vaccination status. MIIS and the system that they use at the hospital, which is called EPIC, talk to each other, but the way that EPIC is implemented on the hospital side, you have to prompt them to pull the information out. And then the immunization numbers and immunization information is separate from any scheduling information. The scheduling information only lives inside the EPIC system, which we are by law and policy not allowed to access as town members, because NCH and NCH and the town are two separate organizations.
Okay.
And MGB owns and runs the EPIC system, and they do not give us access to any of it.
Okay.
So basically, like, there's no crossover between our scheduling and their scheduling, and there's no affiliation between the two programs. But because the Cottage Hospital is absolutely terrible at communicating internally right now, I don't have any other explanation for it, because I've literally had to call their call center and tell them that they're doing vaccines several times now. So it's a point of frustration for me if you're not picking up on the subtext there.
It took a while. It took a while when I went in Monday because he kept saying, I can't do the shot here. And I said, well, I think I'm in the wrong spot. And they wouldn't let me leave. I had to go in the timeout chair for a little bit, you know. And then,
So I know.
finally, about a half an hour later, I did get in.
So I know that the vaccines being administered through NCH's scheduling service are not actually done by NCH staff. They're done by an ambulance. Yeah, like one of the ambulance companies was, they subcontracted that to them. They come over for Mondays, and then they do about 100 doses, I think is what they're marked for, and then that's it for the week. So, and I think that their tentative plans on doing pediatric vaccinations are roughly going to be the same thing. They're not freeing up any of their staff to do it. They're subcontracted out to an ambulance chain.
Does anyone else have any comments or questions for Jericho? That was a lot.
Yeah, sorry.
A lot of confusion.
You would figure it would get simpler as time goes on, but no, it
That's
doesn't.
not happening.
No. Yeah, I don't. There are a lot of things in this position that mystify me, but the way that we're handling vaccines at this point is foremost on them. But yeah, and if you guys do have anything that comes up over the course of your daily lives, send me an email and I'll try and give you the information that I can. It really helps if you have in-community conversations about this, because I know that a lot of confusion around the hospital and our overlapping days, for example, if there was a conversation among the elderly community, they would be a little bit more up to date on what's going on, I think. So anything that crops up about vaccines or anything COVID related, feel free to send me an email.
Do you want to give us your email now?
Yeah, it should be on, it should be, yeah, let me actually, I'll just drop it in the chat. I thought it was on the.
Yes, it comes on, you're right. What our agenda has it on there. Okay.
But just in case, oh no, that's the wrong address. It'll be here in the chat. You can just copy that from the chat if you click on the chat button, and then you can just email me.
Thank you, Jericho.
No problem.
We'll move on to Laura. And thank you, Laura, for sending us your report in advance, but do you want to add anything to that?
I also just sent you all the minutes from the NCEA September board meeting. Obviously, the October, they haven't
Had yet.
yeah, they haven't approved yet. And I just got an email from Jean Grimmer, and they are going to be talking about doing construction in the great room, doing the ceiling, the fans, painting, etc. sometime soon. I don't. It was on my calendar that they were going to start November 19th because they had asked what was the slowest time at the Salt Marsh, which is usually the holidays, because everybody's either traveling away or family is coming and baking pies and whatever. So I don't know what the prognosis of that is going to be. We will have to wait and see what happens. We are having our first program at the senior center, which is next Tuesday. So we're actually having people come wearing masks, you know, sitting correctly. So hopefully that's a nice start. We'll see how many people show up. We did our chat room yesterday with like 3 people showing up.
Good.
Yeah, so 3 is good. We'll see what happens the rest of the season. Obviously, we've stopped the drive-throughs. It's just too cold. And I guess that's kind of it for the add-ons. Any questions from anybody?
Yeah, I've got a quick question for you,
Yeah.
Laura. Are you still going to be able to Zoom from another location within the Salt Marsh, or are you shut down for that time period as well?
Well, I don't really know yet. Nancy. We were discussing that this morning. The other instructors, well, two of the other instructors already Zoom at home, so they can pick that up. I'm thinking if they're redoing that ceiling, they're gonna rip the whole thing down and stuff is gonna be flying all over the place. And, you know, Ginny and I might not even want to be here, you know, breathing in all that stuff. So we might work with you to see if we can figure out Zoom from your house. Because if it's a month, that's a long time. And I tried to convince them or mention to Joe, I said, nobody really wants the ceiling done. Nobody looks up.
Yeah.
They would like to have new fans
And
because
some paint.
one of them doesn't work, but they'd rather be in the building than out of the building. But they're gonna do what they're gonna do, so we will see what happens. And we'll work with you, Nancy, to see, you know, maybe we put plastic up and you come in my office and
Yeah, I think I'll stay home, thank you.
Yeah.
But I can probably figure out how to do it from home.
yes, we can walk you through that. So
Yeah.
we'll just wait and see if what's happening on their end and how it's gonna go.
Sounds good.
Yeah. Well, that's it.
Are there any other questions for Laura? I don't have a question, but I'd like to comment because I attended one of your coffee and donut chats out on the porch. And
Oh,
there were 8 of us that day and we had a fantastic time. So we all decided we'd come back for another one. So it's hit or miss on how many people you get, but we all we didn't even know each other, but we all really hit it off and we had a great time. So thank you for that, Laura. It was,
good, yeah, that's what it's all about.
yeah, no kidding. The
And getting people together that not know each other is a
We-
plus.
each other, it was wonderful.
Yeah, that was excellent. Good.
We've come to the last item on the agenda, and I'll be really quick to give you an update on the Center for Elder Affairs. If anybody has not received their mass mailing, they're doing their annual appeal right now, so I hope everyone on the Council on Aging got an envelope. But if you haven't, it can be provided to you. They're usually very successful in their annual appeal. And the one other thing I'd mention is that Joe Aguirre, who is, or Aguirre, I never know how to pronounce that, who is their president, has had questions from people. Why are you spending all this money on the Salt Marsh when we're going to get a new senior center? So he was very good at clarifying that the senior center that we're going to get is well down the road. And in the meantime, there are a lot of seniors on Nantucket and we need a place to congregate and take classes and see each other, that sort of thing. So that's the reason all this money is being spent. And that's the reason for the dust and the mess. I don't know about the ceiling being needed, but that's why they're spending the money right now.
And possibly some safety violations have to be addressed
Oh,
while
that.
they're making those renovations.
Okay. Oh, all right. Yeah.
I don't know, I'm not gonna, don't quote me.
You're already being recorded, Nancy.
Well, delete.
Everything is where it is supposed to be. The new doors that they put in, they flip both ways because it's now a fire exit. So they have to go out, but we want them to go in. So it's all above board.
Okay.
All good.
We've come to the end of the agenda unless anybody has any other comments, questions, suggestions that you want to bring up. Okay, we've lost our quorum, so we can't vote on anything except to end the meeting. So I don't even know if we can vote on that. So
Hold on, wait. There we go.
are you unrecording us? Is
No, I'm letting my mom in.
Oh, so
good.
we do
We're
have
back
a-
on the forum. We can now end the meeting. The meeting can now be ended.
right on time.
Oh, what'd I miss?
You'll have to watch the tape.
I think I'll read the minutes instead.
Can I get a motion to end the meeting?
I'll make the motion. Yeah.
Okay, a
Second it. Second it,
Who
Susie.
second? Susie?
Susie.
Oh, Su-
Okay,
Sorry,
thank you.
Oh, sorry about that.
it's okay. All right, thanks, everybody. Appreciate it. See you next month.
Thank you.
Thank
Bye-bye.
Thank you. Bye,
Bye, everyone.
everyone.
Thank you.